Unit 11 test questions 2. 71. A clinic nurse administers a Montauk skin test to a client. The nurse tells the client to return to the clinic for reading the results in 1. 24 to 36 hours, 2. 24 to 48 hours, 3. 36 to 48 hours, 4. 48 to 72 hours. The correct answer is 48 to 72 hours. 72. The nurse is assessing the client with the typical clinical manifestations of tuberculosis. The nurse would expect the client to report having symptoms of fatigue and cough that have been present for 1 to 2 weeks, 2. Almost a week, 3. 1 to 2 weeks, 4. Several weeks to months. The correct answer is 4. Several weeks to month. 73. A client with chronic obstructive pulmonary disease who is being oxygen therapy asks the nurse why the flow rate cannot be increased to more than 2 liters per minute. The nurse responds that this would be harmful because it could 1. Increase the risk of pneumonia from drier air passage. 2. Be drying to nasal passage. 3. Decrease the client's oxygen-based respiratory drive. 4. Decrease the client's carbon dioxide-based respiratory drive. The correct answer is 3. Decrease the client oxygen-based respiratory drive. 74. A nurse has instructed the client using incentive spirometer to sustain the inhaled breath for 3 seconds. When the client asks the nurse about the rationale for this, the nurse incorporates the understanding that the primary benefits is to 1. Dilate the major bronchi. 2. Constrict the alveoli. 3. Enhance ciliary action in the tracheobronchial tree. 4. Promote adequate gas exchange. The correct answer is 4. Promote adequate gas exchange. 75. A client who has undergone radical neck resection for tumor has nursing diagnosis of ineffective airway clearance related to obstruction caused by postoperative edema, drainage and secretions. The nurse plans to promote adequate respiratory function by avoiding which of the following activities? 1. Placing the bed in low fowler position. 2. Supporting the neck incision while coughing. 3. Suctioning secretion from the clients as needed. 4. Encouraging every cough every 2 hours. The correct answer is 1. Placing in bed in low fowler's position. 76. A client with active tuberculosis demonstrate less than expect interest in learning about the prescribed medication therapy. The nurse assesses this client may ultimately need 1. More medication instruction. 2. Involvement of the family in teaching. 3. Reinforcement by the physician. 4. Directly observed therapy. The correct answer is 4. Directly observed therapy. 77. A client who is experiencing a respiratory difficulty asks the nurse why it's so much easier breathe out than in. In providing a response, the nurse includes that breathing is easier and exhalation because the 1. Respiratory muscles contract. 2. Respiratory muscle relax. 3. Air flows by gravity. 4. Air is flowing against a pressure gradient. The correct answer is 2. Respiratory muscle relax.